I hope you've heard, because we've talked about it a couple of times in some announcements, like public service announcements and other announcements, that May is Stroke Awareness Month. And so we have with us a physician from University of Missouri MU Healthcare, and it's Dr. Brandi French, who joins us again. And I remember we've talked before, I think maybe about strokes, have we not?
I believe we have.
Your expertise and your interest is in strokes. There are certain things I want to hit right off the bat, something that's probably most important, and hopefully it just starts to become second nature to us, kind of like when kids were taught what to do in case of a fire, I think stop, drop, and roll or something like that. So we need to think of FAST that way. Explain the acronym FAST, F-A-S-T.
FAST. Well, part of the point of FAST is that you need to get to care fast. So F is for face. Have somebody smile, you'll see part of their face is weak on one side or the other. A is for arm. So we say hold up your arms, see if one of them will drift or fall before the other one does. S is for speech. So get somebody talking, have them sing their ABCs or happy birthday. Do those words come out properly or are they slurred? And T stands for time, meaning time is of the essence.
So I like that, and I think that's a nice way of doing a really quick, we've got a concern here of somebody that might be suffering a stroke. But is the face drooping temporary, or is the arm weakness temporary? Or I slur my speech sometime every day on this radio program, but I think sometimes it's more just inattention or maybe just lack of sleep or maybe thinking too many things at one time. So at what point in time does it become alarming? A face drooping, I would guess immediately it would.
A face drooping or an arm weakness is going to be immediately alarming. And like you said, we all sometimes slur our words just a little bit. But if it's persistent and it's going on for a couple of minutes, or I'm just not finding those words and I'm trying to say a word and it just won't come out or it comes out wrong, those are concerns, things to be immediately concerned about as well. And it doesn't necessarily have to last for a long time, because just because symptoms go away doesn't mean that they won't come back. That could be the warning sign before the larger stroke comes.
That's interesting, because I think a lot of times out of stubbornness, people would say, no, it's nothing, it'll pass. But you're saying, especially on those indicators that you just said, don't say it's going to pass, because it could come back.
Exactly. And sometimes it's stubbornness, and sometimes people have had those symptoms, well, it got better the last time it happened. Or I've even heard people say, I just didn't want to bother anybody. I just thought I'd go ahead and get better, and maybe we wouldn't have to worry about this. And
is there anything else that if you were a trained physician like you are, could you look at somebody and look at them in the eyes, or look at just any kind of other signal that would be too subtle for most of us to recognize? Are there those kinds of signals?
Well, there are some, especially things with coordination and other kinds of movement, the way that someone walks, but a sudden vertigo or spinning type of sensation, or eyes that just don't track together, can also be signs of stroke.
What's about the youngest that someone could suffer a stroke?
Strokes happen even in childhood, and that's certainly not common, but we've hospitalized patients in their 20s before for stroke.
That's very sad.
It is.
Now, what is the recovery from something like that? Again, that's an unfair question, because everyone is unique in its recovery and in its and the suffering. Each one is unique, but give me just a general, what's the recovery outlook?
We tend to think that younger patients have a greater chance for recovery because they're so young and the brain is more plastic and able to retrain itself the younger that you are. And there's a lot longer to work on rehab, and usually not a lot of other medical conditions that get in the way of trying to focus on therapy and rehab.
When a stroke happens, what's going on in the body?
The brain is dying. It's just like a heart attack, but think of that same thing happening up in the brain. So most of the time, a stroke represents a blood clot that's in a blood vessel. About 20% of the time, 15-20% of the time, it's bleeding in the brain. But those can often have the same symptoms and often are more associated with a strong and severe headache. But brain cells are dying.
So if absent of a headache, that could be happening without the person knowing something is going on like that? Prior to the drooping of the face and the arm weakness and things like that.
Right. There may not be any symptoms that come before you start to see things from the outside, absent the headache. And some people say, I just didn't feel right when I woke up that morning, but it's too vague to understand or to really know what's going to happen next.
What causes this? What's the best explanation for why someone would have the brain clot or the stroke?
Well, there are a couple of different reasons. One risk is atrial fibrillation and irregular heart rhythm, and that accounts for 20 to 30% of stroke causes. But often it's a combination of the things like high blood pressure, diabetes, cholesterol, smoking.
The connection with the heart there, the afibrio, what'd you say?
Atrial fibrillation.
Fibrillation. That's much easier to say, and my wife, who works with a lot of heart patients, would reprimand me for not being able to say that, but I'm not capable of saying that this morning. So how does that cause a stroke?
So it's an irregularity in one of the pumping chambers of the heart, and rather than having nice coordinated contractions, it's wiggling. And that means the blood is slowing down. And the first thing blood does when it slows down is it clots. And then you can get a nice strong beat that comes in behind it. It dislodges that clot and it goes anywhere in the body. And the brain gets so much of the outflow from the heart that it's very damaging when it goes there.
Dr. Brandi French is our guest. We're talking about this being Stroke Awareness Month and just some things about strokes that you should know. When did you start wanting to specialize in strokes? When does this capture your interest?
When I was a medical student, I loved neuroanatomy, and that's what stroke is. It's all a puzzle of trying to put together where in the brain is something going wrong so that we understand what the stroke is happening, or is this potentially a stroke? And then when I was a neurology resident, really about halfway through, I found, just so much joy in taking care of stroke patients and watching the recovery, but also being able to explain to families what was going on. And that was a time when we were really starting to see a lot of new treatments for stroke, really profound things happening, so that we were helping so much more than we've been able to in the past.
What you just said was what I wanted to ask next. What is new as far as treatment is concerned, or what are the concerns that researchers who want to know more about the stroke? I guess my question is twofold. One is, what are the unanswered questions? And then what is happening that gives hope or that is new when it comes to preventing strokes or the aftermath of strokes?
Well, clot-breaking medication has been around for about 20 years or so, but we're refining the way that we use it, and we're being able to expand it to more and more patients who come in with stroke conditions. We're also able to do more with catheter-based approaches. So just like you go in and get a heart cath with a heart attack, we're able to do that now with blood vessels in the brain. Unanswered questions are, what can we do outside of some of those time windows so that we can try to preserve more brain tissue? And are there better ways that we can preserve brain tissue earlier in the course of a stroke, maybe with additional medications?
What do you use to be able to pinpoint where you need to go after the clot in the brain?
There are special kinds of CAT scans that we do with dye that can highlight the blood vessels. And if you can see a clot on there that looks like it makes sense with a patient's symptoms, then we can take those patients back to the cath lab and they can go in just like they do with hearts.
A couple more things. One is, what would be a typical size of a clot?
Oh, gosh. These blood vessels are only a couple of millimeters in diameter.
What does that compare to? I mean, that's it's not as big as a pea.
No, it's about maybe half the size of a pea.
Really?
As far as the width of the blood vessel. And some of the clots are very short, and some of them can be a couple inches long.
If you've had one stroke, are you likely to have another?
Yes.
Men and women equal? What's the ratio?
Men and women are probably equally affected. It's just that women tend to be affected by stroke when they're older than men. So whereas men may be having more strokes in their 60s and 70s, we see it about 10 years later in women. So women can be more debilitated from stroke than men because they were older when it happened in the first place.
I want to go back to what we started with, and that was FAST, which is face drooping, arm weakness, slurred speech, and then the T is time to call. Mm-hmm. Speak about the quickness. How quick would a physician like to see a patient who is suffering a stroke before they really feel like major damage is done?
Absolutely, immediately. The brain cannot survive without oxygen, and it can't get oxygen without blood flow, and those cells begin dying within minutes. And so the longer you wait, the more cells die, the more tissue damage is done, and the worse the recovery from the stroke is and the more severe it is. So within minutes, patients need to be activating EMS and getting to the emergency department. we can start medication within certain time windows, but you've really got to be there as fast as possible.
Can they do that on a remote location? In other words, let's say something happens in north central Missouri near Unionville, Missouri, where there is no physician nearby, but you know somebody's having a stroke. They place that call to 911. What can be done while that person is transferred to Columbia or to Kirksville or someplace closer?
Well, most EMS providers have a lot of stroke training, and so they are able to recognize and start some things in the ambulance and get them to the nearest stroke center possible. That care, even that early care, can be done at your small local community hospital. They call us when we're on call and get that care going so that we're not losing any time by the time they get to a more comprehensive place like the university.
I was looking at some of the statistics about strokes, and I think this is a shocking one. It said every 40 seconds, someone in the United States experiences a stroke. Every 4 minutes, someone in the U.S. will die from a stroke. So it's pretty prevalent.
Yes, it is.
Happens. Doctor, thank you. Appreciate you being here this year.
Thank you.
And again, it is Stroke Awareness Month. If you'd like more information, and some of the information that I have in front of me right now is on the website muhealth.org/stroke. We appreciate Dr. Brandi French being our guest to talk about that today on KFRU.